How's it going, everybody? It's Dr. Rob with your 2-minute tip this week designed to improve your life through health and fitness. Today we're talking about how to properly lunge and avoid knee pain and extra wear and tear on the knee. So a lot of people end up going, my knees hurt every time I lunge, and most of the time it's because they're lunging poorly and not because they have problems with their knees. Because we've taken patients who go, it hurts to lunge, and they do it and it hurts, and we show them how to do it properly, it doesn't hurt anymore. Most importantly, if you're actually lunging properly, then it's going to activate the most important muscles. You're going to get more benefit. You're going to be able to lift more weight and actually do more and be stronger if you're actually performing the exercise properly. So the most common mistake that we see when performing a lunge is if you're standing here, you go to lunge, your front knee will actually slide forward. So you just lunge and your knee slides forward. That's going to create extra wear and tear on the knee. So when you're lunging, you actually want to lunge, and when the knee goes, then you're actually going to drop straight down so the knee doesn't actually go further than past the toe. One of the things we'll actually do in the gym to help people is put a foam roller or something right in front of that. So if they're lunging, if they hit that foam roller over and knock it over, they know they have that feedback. So this is something you can do at home, you can do it in front of a wall, you can do it in front of the couch, whatever it is. And what I actually suggest that makes it a lot easier to learn this technique is to reverse lunge or go backwards. So most people automatically go lunge, I'm going to lunge forward. Your forward momentum's taking you, it's going to put extra stress on the knee. What you do is you're going to put your toe up to this foam roller, up to the wall, and then you're going to step backwards. And if I just rest at the bottom, you're going to see it puts my knee in the most optimal position. It's going to force me to use my glutes properly and activate, and it's going to stabilize. And 9 times out of 10, you're actually going to be able to lunge without knee pain, okay? So, for example, you just go in, nice straight up and down, come within 1 inch of the ground when you go backwards, and then come back up. Another way to do this that we do in our gym is we use a TRX, so you can hold something, so it's called an assisted lunge, and so same idea, you got half body weight, you're holding, and you can come back up. It's a really good progression to make it more easier on the knees, so you're not killing the knees. Once you can do it where you don't have knee pain, that's when you can progress to a forwards lunge or even walking lunge where it's continuous. If I back up, you'd be continuously walking lunges from there. Again, I did a video where we showed you how to turn every exercise into core exercise. Lunges are an amazing core exercise that if you hold something above your head or beside you as you do a walking lunge, you've got core, you've got glute activation. It's one of the best exercises you can possibly do, and you should never get knee pain doing it. If you have knee pain, talk to one of your therapists. We can get rid of that. That's what we do. Otherwise, add lunges into your repertoire and kick some butt. Have a great week.